One of the truths about hospitalized patients is every one of them will either receive diuretics or IV fluids. It's like when the patient comes into the hospital, we feel like we need to either go up the mountain or down the mountain. It becomes such a fundamental truth that it ends up being one of the initial questions you always ask yourself during the admission process. Is this a patient who needs more fluids, or do I need to remove fluids from the body? Because of this, these medicines become super important, and we need to have more than just a basic understanding of how they work. Intravenous fluids have various uses, but you can break them down into these 6 categories. They're used to treat sepsis and shock. They're used to replace ongoing fluid losses. They're the primary means by which we adjust osmolality in the body. They serve as carrier fluids for medicine and electrolytes. They can provide nutrition, and they can be used to just increase the urine output to prevent the acute renal failure that we see with tumor lysis syndrome, or rhabdomyolysis, or contrast nephropathy. There are 3 fundamental types of IV fluids: dextrose solutions, crystalloids, and plasma expanders. These differ in the location where the fluids end up. Dextrose solutions distribute across the entire body. Crystalloids are locked into the extracellular compartment, and plasma expanders, as their name suggests, remain in the plasma. Dextrose solutions provide water and some nutrition. Their primary use is in the treatment of hypernatremia and hypoglycemia. They have a secondary use as maintenance fluids. Dextrose solutions distribute across the entire total body water, and they distribute as the total body water would distribute, with 2/3 going to the intracellular space, 1/4 going to the interstitial space, and 8% being locked into the plasma space. Crystalloids are the standard solutions used for fluid replacement and maintenance. Crystalloid solutions can either be balanced solutions or saline. Balanced solutions are attempts to recreate the plasma concentration of all the essential electrolytes, while saline is just a mixture of sodium and chloride and water. Saline comes in various concentrations, from quarter normal saline, 0.225 saline, all the way up to hypertonic solutions like 3%. The most isotonic is normal saline, or 0.9%. Crystalloid solutions are locked into the extracellular compartment. Plasma expanders is locked into the plasma compartment, and there are 2 main categories. There are blood components made of fresh frozen plasma, packed red cells, and platelets, and colloid solutions, which are either purified albumin or synthetic osmotic agents like hydroxyethyl starch. Plasma compartments, as their name suggests, are locked into the plasma compartment. The primary difference among these 3 different fluids is how much of the volume of 1 liter remains in the plasma space. When you give a liter of dextrose solutions, only 80 cc's remains in the plasma compartment. If you give a liter of isotonic crystalloids, 250 cc's remain in the plasma compartment. And when you give a liter of plasma expanders, the full liter remains in the plasma compartment.